Good evening, everybody. It is really great to see all of you here tonight. Welcome to the final webinar in the Spring 2024 series presented by Newton Conservators. We are delighted that tonight we have Dr. Sarah Evans here as our guest presenting Pesticides and Children's Health. My name is Beth Wilkinson, and I'll be the host of this virtual event. Barbara Bates is our wonderful technical director. As most of you know, Newton Conservators is an all-volunteer nonprofit that was established in 1961. It connects people to open space and works to preserve and maintain open space in Newton for everyone. We are grateful for the beauty and sustenance that the land provides for humans and the other creatures with whom we share the earth. We acknowledge the Massachusetts stewardship of this land that kept its ecological communities vibrant, strong, and interconnected for thousands of years, and hope to work with them as we strive to maintain and restore our open spaces. Tonight's presentation is by Dr. Sarah Evans, who will share the latest science of how pesticides impact health, about children's unique vulnerability to pesticides, and steps that families can take to reduce pesticide exposures. Dr. Evans obtained her doctorate in neuroscience from the Weill Cornell Medical College and her master's degree in public health from Mount Sinai, where she also completed a 3-year fellowship in environmental pediatrics. Her research focuses on how early life environmental exposures shape the brain and behavior. She is committed, as we can see by having her with us tonight, to translating research to action to promote safer practices and policies that protect families from toxic chemicals. Now, let's learn how to protect our community and in particular the children in it. Welcome, Sarah.
Hi, everyone. So thank you so much for having me and to everyone for joining on a Thursday evening, which is very lovely where I am right now. And so I'm going to talk about risks from pesticide exposure. I'm going to share some of the latest science about what we know about how pesticide exposures impact human health. And I'm going to provide some information about steps that we provide through our team at Mount Sinai on how you can do better to protect yourself. So before I start, I just want to mention the team that I work with at Mount Sinai. So I'm a part of the Institute for Climate Change, Environmental Health, and Exposomics. I'll tell you more about what that means. And so we're a research institute, but we also work together with pediatric providers through our Pediatric Environmental Health Specialty Unit and our New York State Children's Environmental Health Centers, which is a statewide network of physicians who are specially trained in environmental health. And we do a lot of this work with funding both from the state of New York and from the National Institute of Health. So we're a research institute, but we're also healthcare providers, and we do a lot of work to educate and advocate. So the research that we do on environmental health doesn't stay inside the laboratory, but we bring it out to improve health through clinical applications, through trying to drive policy that will really protect people from harmful environmental exposures, and of course, through educating the public. So a lot of the work that we do is really driven by what we know about the increase in chronic diseases over the last several decades. And our lifetime risk of many of these chronic illnesses, neurodegenerative diseases, neurodevelopmental diseases like autism, cardiovascular disease, cancers, has doubled or tripled over the last 20 years. You've probably seen a lot of recent information in the media about studies showing, for example, colon cancer showing up not only in people in their early 40s, but even in teenagers and young adults. So we're very concerned about this increase in chronic diseases that really can't be explained by genetics or by diagnostic testing alone. We know that essentially every disease has an environmental component, whether that's a cause or an environmental factor that worsens the disease. So this is just, again, to share that we are a part of the Pediatric Environmental Health Specialty Units, and which is a nationwide network, actually. We serve New York, New Jersey, Puerto Rico, and the Virgin Islands, but there's also a PASU in Massachusetts that serves your region. And it's a small but very mighty collection of health professionals and researchers who are taking all of this work out into the clinic. And we have a clinic on site at Mount Sinai where we can treat individuals who experience harmful environmental exposures. And again, we have a New York State network. So when I talk about environmental health and environmental exposures, in our field, we're really moving towards thinking about a concept called exposomics. And exposomics considers the whole, I talk about it as a toxic soup of factors, and I shouldn't say all toxic. So we're exposed to both harmful and positive things in our daily environment. And these are things like our diet, pollution, chemicals, pesticides that I'm going to talk about today. Plasticizers, also things like stress, social supports, and all of these interact with who we are to affect our risk of developing disease. So I'm going to talk about pesticides specifically, but really the way that we study how the environment impacts health now is to look at the whole context of everything that we're exposed to and what our makeup as individuals is. So on that note, many of us have what we call a chemical body burden of hundreds of chemicals, and the CDC conducts these studies regularly on a representative sample of the United States population beginning at age 3. And what they find when they look in the blood and urine of your average American is that we all have something like 200 plus chemicals in our bodies. More than 40 of those are pesticides. I should say that we can't test for every chemical. We don't have a test for every single chemical that's out there in our universe and in the products that we use on a daily basis, even for every pesticide that we might be exposed to. So this is really an underestimate of the chemicals that we're regularly exposed to. And what we're particularly concerned about is that many of those exposures are higher in children. I'm going to talk about that. And there are also racial and ethnic disparities where Black and Hispanic participants in these studies tend to also have higher exposures. And these are probably like chronic, low dose, cumulative, additive exposures that occur as we're sort of moving around our environments on a regular basis. So these are not high levels of chemicals that you would expect a poisoning, for example. And so this is what we're really trying to understand. How do all these chemicals that are floating around in our environments that get into our bodies act together to impact our health? So to zero in on that one class of all of those chemicals that make up our universe, we're going to talk about pesticides today. And so pesticides, sometimes people think that when we say pesticide, we mean an insecticide, so a chemical that is toxic to insects, but we're really talking about the whole class of insecticides, herbicides, rodenticides, fungicides, and even antimicrobials. So the things that we may use to, I have here a picture of a quaternary ammonium disinfectant, right? A disinfectant, something that kills bacteria, kills germs. We also consider a pesticide, and those are regulated as pesticides by the EPA. And you know that these things can be sprayed. They can be in a granular form. They can be in a bait trap form. They can even be used as fumigants inside of a home. And so children are uniquely vulnerable, not only to pesticide chemicals, but to many of the other chemicals that they come in contact with on a regular basis. And when we think about pesticides, there are a number of reasons for this. I mentioned that they're exposed to higher levels, and this is probably because they're closer to the ground where pesticides settle in the soil, and they spend more time down there on the ground. They also breathe more rapidly. So anything that's floating around in the air, they're going to have higher exposures to when they inhale them. They naturally put lots of things in their mouths and put their hands in their mouths. So any kind of residues on items that go in their mouths will be ingested. And then they tend to eat sometimes a less varied diet. So if they're eating a diet that's very rich in things that tend to have high pesticide residues, they're going to get a heavier dose of that. But they also eat more and consume more water per their body weight than an adult does. So anything that's coming into their bodies through food or water, they're going to experience a higher exposure. And then, of course, they have more future years of life. A lot of the things that we are concerned about with pesticide and other chemical exposures have long latency periods. So it takes a long time for those diseases to show up with probably repeated exposures in the environment. And so when you're exposed to something like a pesticide chemical really matters. And we call those in our research studies windows of susceptibility. So when you're exposed, if you're exposed during, for example, a time period where there's a lot of rapid organ growth and development going on, systems tend to be more sensitive. And because for example, the brain and the nervous system and the reproductive system are developing well into early adulthood, those tend to be continually sensitive periods. So we think about the prenatal period, infancy, but also adolescence and early adulthood as being periods where developing systems are going to be potentially most sensitive to exposures to chemicals like pesticides. And this is an example of a study of a legacy, we call this a legacy pesticide, DDT, which is no longer in use in the United States, but still remains in soil and in some cases in water. And so what this study showed really nicely was that first, that DDT was associated with an increased risk of breast cancer. This is one reason why DDT is no longer used, but you often see sort of historic images of children running behind a truck that was spraying DDT around a neighborhood to combat mosquitoes. And I'm going to talk a little bit about mosquitoes and other types of pest control towards the end of the talk. But what they found was that if children were exposed either when their mom was pregnant with them or in their early childhood up to the pre-pubertal period, they had an increased risk of early onset breast cancer. And so they were at higher risk, more than a 5-fold risk of going on to develop breast cancer before the age of 50. Whereas if they were exposed in the pubertal period or later, so after the breast tissue was already developing, they were also at a higher risk of breast cancer, not as high of a risk, but to develop it after the age of 50. So this just demonstrates first a link between pesticide exposures and cancer later in life, but also sort of like the importance of when that exposure occurs and why we're so concerned about pregnant women and young children's exposure to pesticide chemicals. So not only is your personal exposure what's important in predicting your risk from a pesticide exposure, we also know that pesticide exposures can be transgenerational. And so that means that they can even skip a generation. So if your grandmother was exposed to DDT while she was pregnant with your mother, your risk of going on to develop breast cancer as the granddaughter is elevated. So you can see where you can actually have inherited diseases that are not genetic, but that are really induced by environmental chemical exposures. And DDT is just one example. So we think about children, pregnant women. We also can't forget about pesticide applicators. And a lot of times, we're talking to communities who are thinking about how they can, convince landscapers or their municipality to, prohibit the use of certain types of pesticide chemicals. And I think it's really important to remember the impact on workers and landscapers. And a lot of what we know about pesticide exposures and health impacts comes from very large studies of pesticide applicators and their families, like the agricultural health study. And you may be familiar with, I'm going to talk more about glyphosate, the active ingredient in Roundup, which is a very commonly applied herbicide chemical. And this is Dwayne Lee Johnson, who is famous because he developed non-Hodgkin's lymphoma, which was linked to his use of Roundup or glyphosate as a groundskeeper. And so a lot of what we know comes from the illnesses that we see in pesticide workers as well as their families. So, sort of the question is like, how did we get into this mess? And I'm going to talk a little bit about, just sort of the sheer number and amount of pesticide that's applied across the country. But how did we, I was saying before we began this talk that I live in a suburban community, which has very small plots, sort of like what you see here in this image. And it's like, very important because everyone can see your yard. It's very important to keep, a nicely maintained green lawn. And so this is a picture from a community on Long Island called Levittown in the 1940s. And essentially these homes, these housing developments grew up in suburban areas. And part of your responsibility as a homeowner in your deed, you agreed that you would, very carefully maintain your yard. And the pesticide industry and the landscaping and lawn care industry, not only in terms of pesticides, but also in terms of gas-powered lawn mowers and now leaf blowers and all of those devices, which is another talk in and of itself, really sort of grew out of this kind of feeling that we needed to have these really carefully manicured lawns. And so today we have a situation where we are very reliant on pesticide chemicals, and we need to apply more and more to combat super weeds. So we have, overused pesticide chemicals to the point that the weeds are now developing resistance. So we need to either apply more pesticide or develop newer, stronger, potentially more toxic pesticides to meet that demand. But we also have the issue of climate change. I'm going to mention this a couple times, where climate change may be actually worsening the growth of super weeds, making all this stuff grow even faster and for longer seasons, and also increasing vector-borne illness transmission, more mosquito activity after a lot of wet weather after these major storms. So we're sort of in this situation where we've become very reliant on pesticide chemicals. And so, when you walk into the hardware store, there are many of these products available to you. And understandably, we assume that these have been proven to be entirely safe for human health, for our children, for our pets. We don't need any license to get this product and bring it home and use it in our homes. And so we're in this situation where this is kind of old data now, but just showing some of I pulled this from an EPA market estimate report, showing some of the top pesticide chemicals. Sorry, I think this slide got a little messed up, but these are the top pesticide chemicals that are used either in the home and garden or in the agricultural industry. I'm sure you recognize some of these. Many of them are herbicides, and actually I think all of them are herbicides. And I want to make the point, and some can argue a little bit differently, that a lot of what we're talking about is cosmetic. And so when we're talking about using, all these various chemicals on our lawns, we're really using it for cosmetic purposes. I'll talk a little bit about, the public health need for pesticides in certain situations. But really these are being used so that we can have like a weed-free lawn. And I've just aligned some of the health concerns that we have, which I'll talk more about, that are associated with each of these. So we're applying these at more than 1 billion pounds a year in the United States to 88 million homes. At the time, I think that this data was compiled, it was a $14 billion industry, but you can see that this has really grown to more than a $25 billion industry in 2023. And so again, you think, but I can buy it in the store, I can use it at home, so it must be safe. Unfortunately, there's a lack of transparency in ingredients. So when you look at a label, the pesticide company does not need to tell you everything that's there. So it's hard to know what's there. I talked about exposomics and thinking about this whole chemical universe collectively. But when chemicals are studied by EPA to be approved for safety, they really only look at one chemical at a time. So we don't know how they interact with each other. Many common pesticides are under what they call registration review frequently, where they go back and they review all the human health data or any emergent data. And this can take up to 15 years for them to review all the data before they, decide, okay, we're going to pull this from the market. Some of you may have seen some of this happen for chlorpyrifos, an organophosphate pesticide that I'll talk about a little bit, where there has been a preponderance of evidence that chlorpyrifos is toxic to the developing brain, toxic to human health, and yet it stayed in the marketplace for many uses for many, many years until it was finally pulled. A lot of times you see toxicity labeling on a pesticide chemical, ranging from caution to danger, poison. This tells you something about the acute exposure. So if you were to experience like a high level exposure while you were applying it, but it doesn't, this is things like skin irritation, eye damage, doesn't consider, regular low-level chronic exposures. A lot of these pesticide chemicals also have long half-lives. So I get a question a lot about, well, my landscaper said that it's okay to go on my lawn 24 hours later or 72 hours later. Half-life, the amount of time that it takes, half of the chemical to break down in the environment, is often much longer than 24 hours or 72 hours. Glyphosate has been shown to stay in soil for hundreds of days, and that's largely also dependent on weather conditions, for example. And so indoors, when pesticides get tracked indoors or applied indoors, they can last even longer because they're not exposed to weather or UV light. So these chemicals are really out there in our environment, potentially longer than we expect them to be there. So health risks, you're probably familiar with many of these, and I'll talk a little bit more about some. They interfere with essentially every system of the body. We know this, again, from a lot of the studies of agricultural workers, but also of just sort of the general public when we look at kind of baseline low-level pesticide exposure. So impacting brain development, contributing to asthma, interfering with hormones in the body, associations with cardiovascular disease, cancer, and metabolic diseases like diabetes and obesity. So most things that you can think of have been shown in epidemiological studies to be associated with pesticide exposure. So I want to talk about a couple specific types of pesticide chemical and focusing on a couple of the most common classes that you may have heard of that are widely used in our communities. And so I think when Beth introduced me, she said that my degree is in neuroscience, and so I'm very interested. A lot of my research focuses on how environmental exposures impact the developing brain. And so it's important to understand that pesticides that target insects are actually designed to be toxic by interfering with the nervous system of the insect. And many of the parts of the insect nervous system that pesticides interfere with are also conserved in mammals and in humans. So pesticides can act similarly in us as they do in insects. And so these are some just examples of some types of the main classes of chemical or pesticide chemicals that we use in our homes. Organophosphates, organochlorines are used far less now. DDT was in this class of chemical, but pyrethroids, I'll talk more about, are very common, commonly used as a mosquito preventive in our yards, and neonicotinoids, which you're probably also familiar with, that target insects and grubs. And so I've just sort of highlighted here, these are two nerve cells in the brain, and where each of these class of chemicals interferes with the molecules that allow these two nerve cells to communicate with each other. So they're interfering with their ability to talk to one another, which then impacts our ability to think and for our brains to function, and can even lead to death of those cells if exposure is high enough. So pyrethroids are very commonly used. Again, if you call most mosquito control companies, this is what they want to come out and apply on your lawn. And often those companies will tell you that this is a natural product that's found in the chrysanthemum flower. It's a synthetic form of a natural chemical that's found in chrysanthemum flower. I think two things that are important to note. One is that not everything that's natural is non-toxic and safe, but also that it is disingenuous to say that what they're applying is what is actually found in the chrysanthemum flower. It's not. It's a synthetic chemical that's based off of the molecular structure of that. So that's important. And so when you see these words a lot, many of the pyrethroid chemicals end with rin or thrin. So permethrin, resmethrin, sumithrin, bifenthrin, perlethrin. These are all commonly applied pyrethroids. So it's a whole class of chemicals. You won't necessarily see pyrethroid on the label, but you will see one of these chemicals listed as the active ingredient. So if you're curious, you can ask your pesticide applicator, what exactly are you using? And if they tell you, well, it's just something that's found in flowers, you can say, can I see the label? Or can you tell me exactly what the active ingredient? But I would ask to see the label. And so they're used for a lot of different, not only tick and mosquito outdoor pest control, but also cockroaches and bed bugs as well. They're often combined with other chemicals. So that's the other thing that's disingenuous about saying it's from a natural chrysanthemum flower. There are many other chemicals that are combined with that product that are not necessarily listed on the label. They are harmful to the environment, toxic to fish and bees. Some of them have been classified as likely human carcinogens. And in research studies, they've been associated with impaired brain function. So that's pyrethroids. Neonicotinoids are another class of insecticide, pesticide. They get a lot of attention, and largely because of their potential contribution to bee colony collapse. They have been shown to be highly toxic to pollinators in general. Again, you don't necessarily see neonicotinoids. Sometimes people refer to these as neonics. You don't necessarily see that on the label, but you'll see, a host of other subtypes of the neonicotinoid class. Because they're so widely applied, they're detected in groundwater, so may get into drinking water, have been detected at low levels in foods, including baby foods. These are, again, some chemicals that we don't have the full picture on exposure because we don't necessarily test for every single one of these chemicals. But it's estimated that most of us have some level of exposure through the environment and foods that we eat, even to the point that they've been detected in cord blood and breast milk. And again, not surprisingly, based on the mechanism that I showed, they can be harmful to the nervous system, but also contribute to a whole host of other health effects. And we can't overlook, the fact that the loss of pollinators is also, detrimental to our food supply. And so these are just some studies. I'm not going to go through them in depth, but just to show you, again, that we have a number of scientific studies in the peer-reviewed literature that support the idea that many of these common pesticides are toxic to the developing brain. And most of these studies are in children, in pregnant women, and in people who are exposed, not agricultural workers. Some live near an agricultural field, but not in all cases. In many cases, this is just sort of within the range of the exposure that many of us experience from our normal environments. With the other, major health outcome that has been well studied for pesticide exposure is cancer. I already talked about DDT, but there's also some evidence. Many of these studies are recall studies with women whose children have gone on to develop childhood cancers that suggest that use of pesticides may be associated during pregnancy, may be associated with increased risk of some childhood cancers. And these are areas that do need much more study. But I mentioned in the farming studies, we do have more data showing that children who live close to agricultural areas have increased risk of child leukemia. And in farming communities, we definitely see higher rates of a number of different types of cancers, particularly in the pesticide applicators. So glyphosate, again, the active ingredient in Roundup, which I already referred to, you can see this really massive increase in use of glyphosate across the country that has part to do with superweed production. Like I mentioned, we're needing to apply more and more pesticide to have the same effect because the weeds are becoming resistant. And these two maps are comparing 1992 and 2019, and just showing where the darker brown is where there's more glyphosate pesticide applied. And this is also in part, I can't remember, I don't know if I have the slides here, but this is also in part due to glyphosate resistant GMO soy and corn crops. So with the rise of genetically modified corn and soy that's resistant to glyphosate, so you can put a lot of glyphosate on those crops and kill the weeds, but not kill the crop itself. farmers are able to apply much more. And so that's also why we've seen a huge increase in the amount of glyphosate that's applied in the US. And so I mentioned Dwayne Lee Johnson and his case of non-Hodgkin's lymphoma, in which he was awarded a settlement from Monsanto because of that. But these are just some examples of other studies. These are, again, large agricultural studies, the agricultural health study in the United States, but also a similar study in France and in Norway, all showing an increase in non-Hodgkin's lymphoma associated with the use of glyphosate-containing herbicides. There are also concerns about non-cancer health risks related to exposure to glyphosate, reproductive development, disruptions of the gut microbiome, which could interfere with immune dysfunction, also lead to cardiovascular problems. And in rodent studies, this hasn't been replicated in human studies that I'm aware of, an increase in autistic-like behavior, so maybe also interfering with the brain and behavior. So that's a little bit about some of the most common pesticide, insecticide, and herbicide ingredients. And I mentioned that, for example, many pyrethroid chemicals, this is an example of a label from a permethrin-containing pyrethroid product, contains this synergist, PBO, or piperonyl butoxide, is a synergist that makes this product more active, and it makes it stick around longer. So again, it doesn't break down as quickly as you might like in the environment. And this piperonyl butoxide is actually classified as a possible human carcinogen and has also been associated with impaired neurodevelopment and increased risk of wheeze and asthma. So it's just to say that it's not only the active ingredient, that pesticide chemical that we're worried about, but the other products. You can also see it contains petroleum distillates. So these are also petroleum-based products, and I'll say something about that too. So here you can see now this is an example of a glyphosate-containing herbicide, and if you look at the label, you can see that 36.5% of this product is glyphosate, but 63.5% is other ingredients, and you have no idea what those are, and we don't know the health impacts of that combination of ingredients. And like I said earlier, when the EPA looks at safety data around these chemicals, they don't look at the product, they just look at, the single chemical at a time. So these, again, are petroleum-based products. I mentioned that we have changing pest control needs. We need more pesticides, in part because of climate impacts on the environment. Pesticides are also interfering with the ability of both soil and the ocean to act as a carbon sink and pull carbon out of the environment. So the more pesticides we use, the more we're exacerbating climate change and the more pesticides we need. So it's really kind of a cyclical thing. And we also need a lot of water when we make and use pesticides. And so we think about the direct exposure to pesticide chemicals and the impacts on health, but we also can't overlook all of the repercussions of climate change on our health, including things like extreme heat, really bad pollen season that we're having right now, vector-borne diseases, and so on and so forth. So just to point out that our use of pesticides is closely tied to climate change. I mentioned, earlier about, for example, in Florida, after some recent hurricanes, they had massive outbreaks of mosquito populations and potential increase in mosquito-borne disease. And so this is just some data to show how much what we call mosquito days have increased from 1979 to 2023. So a mosquito day is a day when the average relative humidity is 42% or higher, and the daily minimum and maximum temperatures are between 50 and 95 degrees. And so we reach those conditions even in the Northeast on 129 days out of the year. You probably all have the experience of thinking like, well, it's November, why am I getting bit by mosquitoes right now? Or early spring or late winter, and all of a sudden the mosquitoes are out. And so because of this, mosquito-borne diseases like West Nile virus are predicted to double by 2050. And that actually contributes $1 billion a year in healthcare costs and premature deaths. So this is really no small thing. And we need tools to prevent this. So we're seeing more vector-borne illnesses with climate change. And how can we sort of safely prevent those? This is unlike the issue of weeds and cosmetics on our lawn. This is a potential public health issue. So there are, fortunately, safer and more effective ways to protect ourselves and our families and our yards from mosquitoes, and on a community-wide level as well. And so instead of willy-nilly spraying pyrethroid pesticides, which are adulticides, which kill adult mosquitoes, and sort of rely on hitting one of them as it flies by, so not that efficient. There are strategies that you can use that actually prevent mosquito breeding, like removing standing water, cleaning out your gutters, and using larvicides. So these have very low impacts on human health and the environment. For example, this particular larvicide, BTI, is made from a soil bacterium that has been shown to be safe for use around humans and safe in the environment. Encouraging natural predators in your garden and your yard is really cool. And then there are ways, try to keep the mosquitoes out of your home, wearing loose fit clothing, staying indoors at times when mosquitoes are most active, and the safe use of insect repellents, which I want to talk about a little bit because we get a lot of questions about that. And this is just an example. I'm going to share a link to this later at the end of my talk. We have a program through our New York State network called Prescriptions for Prevention that are really action-oriented prescriptions that could be distributed in communities or in doctors' offices to give people steps that they can take and connect them to resources around protecting themselves from environmental exposures. And so in this case, we do recommend, when needed, when you're in an area and a situation where the risk of a vector-borne illness is high, that you choose insect repellents. So using an insect repellent that contains 20 to 30% DEET, no more than 30% DEET, has been shown to be safe and effective. You can also try 20% picaridin, oil of lemon eucalyptus, but it has not been tested for children over 3. So just to say that there are steps that you can take to safely use an insect repellent when you need it. We get this question a lot with kids going off to camp. And so these are just some of the tips that we provide. And I can talk more about that later, but sometimes people are surprised to think that, DEET has been used for many decades and has a very good safety profile in research studies, even for pregnant women. So these are the recommendations that we give versus, for example, aerial spraying or spraying your entire yard with a pyrethroid chemical. So this is just kind of like thinking about if you need a mosquito control practice, for example, going from sort of like worse to better, safer, lower chemical exposure strategies where, aerial community spraying would be the least desirable and lead to potentially the most exposure to chemicals, whereas, moving sort of up the arrow towards using non-chemical personal protections when you can would be the best in terms of reducing exposure. And I just wanted to point out that in Massachusetts, there is a way that you can get notification when community spraying is happening, and that where you can request exclusion from wide area pesticide applications. And so, of course, we have mosquito-borne illness, ticks. I grew up in Connecticut. Ticks are on my mind year-round. I also have small children. And so you can see how much the reported Lyme disease cases have increased from 2001 to 2014. It's not only Lyme now, we're seeing tick-borne illnesses that we used to not see as far north as we are, traveling north and increasing. And these are very serious diseases. Lyme disease can be extremely debilitating, I'm sure that you know. And so it's important to protect ourselves. We think that, in large part, we're seeing this increase in reported cases because of the changing climate. And you can see here we are in the Northeast, and this is 10 years ago now, compared to the beginning of the 2000s. So what can you do? I think it's important to note first, familiarize yourself with what these things look like. I imagine many of you are familiar. And so I think one thing that often surprises people is how early these ticks are coming out. And every year I'm hearing, it's January and I just pulled a tick off of my kid or my dog. And so very early in the spring, even, sometimes in the later winter now, you can see, and into the summer, you can see these tiny larvae and nymph stages of ticks that are just much smaller, much harder to detect. And for that reason, we see, the highest incidence of reported Lyme disease pretty early. And this is probably even shifting, but in the spring, and then a big jump into June when those really, really small larvae are prevalent. And then later on into the fall, you also have more people outdoors, obviously, during the season. But later on into the fall, the adult form is more prevalent. Those are bigger. Those are easy to catch and get off of yourself. And so here you can just see, again, this is a great concern for the youngest children who are close to the ground and rolling around, and can often be harder to find a tick on them. So what can you do? Again, we recommend when you can try a non-chemical strategy, like using your clothing, long pants tucked into socks, staying in the center of the trail. Ticks don't jump or fly. So the only way that they get onto you is if you brush up against the vegetation where they're sort of waiting, or through a pet as well. They're very hard to kill. They're very hard to get rid of, but high heat for 10 minutes in the dryer will kill them. So throwing your clothes in the dryer quickly, checking everything, showering as soon as possible. And then in your yard, ticks really like piles of wood and debris. So to the best of your ability, not having those or staying away from them. Fences can keep host animals out. Even a gravel or a mulch barrier around your property can help. And, we call these deer ticks, but they really travel on small mice and things like that. So keeping deer, maybe I don't need to tell you all this, but, keeping deer out of your yard is not necessarily the trick. A lot of people say, but I don't even see any deer around here, but it's really, the small mammals that are carrying the infected ticks into your yard. And of course, doing a great tick check, particularly on your children after you've been outside. But so again, as an alternative to widespread spraying, and I know a lot of people, rightfully so, are concerned about tick-borne illness. And so the reaction is to, do widespread spraying of your entire lawn, for example, with a pyrethroid pesticide. The use of tick bait boxes has actually been shown to be very highly effective. So these have a pesticide chemical in them, but it's localized. So your children and your pets should not be exposed. Just the small animal that enters to eat the bait gets the exposure. And so that's one strategy. Some people use a cedar oil on their lawn, which some studies have shown to be effective and is safe. And again, the same thing that I said before about using tick repellent. And another point is to not use a combination sunscreen bug repellent, because you need to apply sunscreen frequently. You really, if you're using, for example, 20 to 30%, one single application to exposed skin should be enough to last, the duration that it should not need to be reapplied. So I talked a lot, I think, about sort of behavior change, things that you can do as an individual, but the most effective strategies that we can take to decrease our own exposure, because we really don't have complete exposure. You can control what's in your yard, but you can't really control what's happening at your children's friends' homes or on the public property in your town, and so on and so forth. And so market pressure supporting landscapers who are, moving towards organic management or less synthetic pesticide use. Stronger regulations, absolutely key. Advocating to restrict pesticide use on public property in your community or on a statewide or national level is the way that we're really going to get decreased exposure. I just wanted to give like a little bit of good news, which is that there are studies that show that even after switching to an organic diet for a short period of time can be highly effective at reducing pesticide exposure. Note that it's not complete. So this is showing some herbicides, nicotinoids, pyrethroids, organophosphates. This was a study that had individuals switch from consuming conventional produce to organic produce. And I can't remember if it was for 3 or 5 days, but a lot of the chemicals, a lot of the today's commonly used pesticide chemicals have a short half-life in the body. So they're excreted from the body fairly quickly. So when you stop consuming them or you stop your exposure, you can dramatically reduce your body burden. Again, it's not complete, right? So there are other exposures out there in our environment that we can't totally control, but by making this change, you can. Again, that's not totally accessible to everyone to consume organic foods all the time, and we don't necessarily recommend that. But we do recommend, if you can, encourage local farmers to try to use less pesticides, or if you have the resources, to support organic so that it can become more affordable and available to everyone. So these are just some simple steps. I think I'm wrapping up in a minute, but so these are just like some very simple steps. Most of them are free or inexpensive that can actually reduce your exposure to pesticide chemicals. So we know that that pesticide chemicals are tracked into our homes, on our shoes. And there was actually a study done by the EPA that showed if you use like just a doormat, or even better, leave your shoes at the door. Also things like luggage or, things that are wheeled strollers. If you leave those at the door, you reduce the amount of pesticide residue that's inside your home and in the dust in your home. Similarly, a lot of chemicals, not just pesticides, but many types of chemicals settle in dust. So just trying to, use a regular wet mop. You don't need any cleaning chemicals or a wet microfiber cleaning cloth. Cleaning up dust can reduce your exposures in the home. Hand washing, practicing IPM. So these are things, in your home, instead of needing to apply pesticide chemicals inside your home, sealing up cracks and crevices, making sure that food is contained in a sealed container, and things like that can keep pests out of your home. And then, of course, there's sort of the social pressure and the normalization. This is my yard last year or the year before, showing your neighbors, telling your neighbors that you have a lush green lawn that you're maintaining without pesticide chemicals, maybe hopefully without fertilizer even. And so I think, a lot of our lawn and garden habits at our homes are a response to social pressure. And so I think we need to normalize imperfect lawns and gardens. But policy is the best way to go. These are examples from New York. In New York City, it took several years, but we were able to get a complete ban on synthetic pesticide chemicals on New York City public properties and parks. And we have been in a partnership with Beyond Pesticides to help launch that and train the Parks Department in how they can maintain the parks without synthetic chemicals. New York State just finally this past year signed a law to ban neonicotinoid pesticides, the Birds and Bees Protection Act. And so we're seeing these kind of actions across the country, which is really the best way to prevent exposures. So we're seeing pesticide bans. There has been a rise in US organic sales. Many of the chemicals don't stick around as long as DDT did, for example. We can rapidly reduce exposure, but we can also mitigate our risk. Again, thinking about exposomics, positive exposures. We don't have a full understanding of, how this works exactly, but nutrients in our diet, social interaction, engaging with others, engaging with your child, reading to your child, strong education, all those things can help to mitigate some of the risks that we might see from pesticide chemical exposures. So these are links to some of our resources. We have resources for youth. We have fact sheets and infographics. I will share these links later. They can, I think the organizers of this talk said that they would email them out, but you can scan the QR code to link to them as well. We also are active on Instagram, Facebook, and LinkedIn through our institute, as well as our New York State network and our PASU. So if you want to keep up with all of our activities, I encourage you to follow us there. And this basically says much of the same of what I just said. You can find us at our website. You can make a donation to our institute, and you can even get involved with our advisory board if you're interested. So I will stop sharing and then take questions.
Oh my goodness, Sarah, thank you so much. You gave us so much information and motivation to act. So let us go to questions now as we try to figure out what we need to do. As I have a couple questions from way back at the beginning, because I had no idea this exposure could be transgenerational. And that was just amazing to hear. And you talked about in utero exposure. Can it be passed from the father as well as the mother?
That's a great question. And we tend to focus on moms, which is really unfair. For pesticide exposures, I don't know that that's been looked at. I think the research is trying to catch up because there's so much burden and pressure on mom, right? But we do know from other types of exposures, like endocrine disrupting chemicals, that there can be effects, for example, on sperm and sperm development. So absolutely, environment can impact the father. The transgenerational aspect of it sort of has to do with as the fetus is developing, the eggs, especially in girls, right? Like you develop all of your eggs in utero. And so that's all you're going to have. And that's your future progeny. And environmental chemicals can impact the way that the genes are expressed in your future progeny through your grandmother. If I know that sounds very complicated, but we think that's what's happening. And then, that person is born, and it's her offspring, her female offspring, that go on to be affected. So it's a little bit different, in terms of the way that eggs develop versus the way that sperms develop. But we are starting to look more at fathers and what they might pass on.
Okay, because when I saw the photos of the landscape workers you showed, they were all, so that's what made me think of it. Is there a way, if someone has been, oh, sorry.
Oh, no, go ahead.
Is there a way to detect if someone has been exposed? I mean, you talked about how there were, 40% or 40 chemicals could be found. Can the average person be tested and find out what their exposure is? And is there a purpose to it? Probably not.
Right. So right now, really the only reliable way to do that is by being involved in a research study. So that's where we get all of that data from, or being enrolled in that big CDC study. We really don't recommend, some people want to go to an independent company and get their whole, get their body burden measured. It's not going to tell you, we feel it's not going to really be predictive. What it will tell you is that, maybe you should reduce your exposure to XYZ, but we just recommend that you should take the steps to reduce your exposure to XYZ, right? So it wouldn't tell you,
right,
you're definitely going to go on to develop, a certain disease. So we say, take the steps to take the precaution. You don't necessarily need to do the testing.
right. Make the assumption. It's
Right.
great. We received a couple questions about the pyrethrum infused socks or hats or various things. So those, from what you say, carry problems. I mean, I know when we've brought people out on tick projects, well, one thing we do is tell them to wear, as you told us, the light colored socks, but we've also gotten those insecticide infused socks, assuming there'd be less exposure. But it sounds like they may be bad.
It's a tough one. I think, we say if you want to use those first, I would not do it yourself. Some people treat the clothing themselves. That comes with a high risk of exposure as you do the treatment, and you may not do it properly. We have some concerns about washing, that some of that does come off, in the laundry and then could contaminate your other laundry, get into water. So it's not my primary suggestion. I think there are, I know, there are people are in certain situations where they need like very intense protection. But I think it's a tricky one.
It does sound tricky. I also read when I was first looking them up that they're highly, even the ones like Insect Shield that you buy are highly toxic to cats. So that's kind of scary if they can kill a cat. Clearly there are issues with it besides.
Yeah.
Okay, we have trying to we figure out where we go next. Heidi's saying, are you familiar with Susanna Lerman's work? Longer lawns do not have ticks. They are in taller vegetation. Also, do these bait boxes poison predators like birds that may eat small mammals?
That's a great question. I don't know the answer to the bait box question. And I will look into that. I think I have not heard the big one that we hear about is with rodenticides. And this is a very different chemical that brushes a little bit on the back of the rodent, but I will look into that. They haven't been like the culprit in the way that rodenticides have been. So I haven't seen that, but I will look into it. And what was the other part of the question? Oh, the lawn length.
Yep.
That higher lawns. I don't know. Higher lawns are.
She said that longer lawns do not have ticks. They are in taller vegetation.
Oh, okay. I don't know.
I'll have to look up Susanna Lerman. Thanks, Heidi. Where do we go next? Is it necessary to thoroughly wash organic produce?
I mean, it's necessary to wash all produce, including organic, for bacterial removal, of germs. Washing produce doesn't have very much effect on reducing pesticide residues. Typically, we don't recommend any of those, like vegetable sprays or anything like that. Usually just like rinsing with water to remove bacteria. So yes, it's necessary to wash for that reason. But also washing conventional produce doesn't necessarily remove the pesticide residues, unfortunately.
That's a shame. Does rubbing it help?
No, there have been some studies that have shown that like a baking soda bath can help. One issue is that it depends on how the pesticide is applied to the produce and what kind of produce it is, because sometimes it's really like internal, absorbed into the produce. If you look at, many of you probably already know about environmental working groups, Dirty Dozen and Clean 15. So you can see what some of the major culprits are. It's very often conventional strawberries, grapes, peaches, a lot of the soft flesh produce that tend to have higher residues, and apples, the ones that kids eat a lot of, unfortunately. But hard to wash. So that's sort of one of the workarounds, recognizing that not everyone can get everything organic, but looking at the dirty dozen versus the clean 15. And if you're eating a lot of the things that are on the dirty dozen list, try to have those be organic if you can.
It was neat, the graph you gave that showed how much the exposure can be, the detectable amount can be reduced after just, what did you say, 5 days?
I think it was something like a 5-day swap out.
So if kids are exposed and let's say they have an exposure, I don't know, they go to visit a farm and they've had a really high exposure, does that naturally get reduced over time if they don't have repeated exposures?
Yep. Yeah. So we think that, the health impacts are really from kind of like daily chronic exposures over time, not like a one time. And that's the other thing to keep in perspective. If you're very concerned, if you like to, mostly feed your child organic, but they go to grandma's house and grandma doesn't do that, or a birthday party or whatever, those are short, even if it's, like happens on more than one occasion, it's okay, right? Do the best that you can to reduce. And again, like we don't have complete control over it, which goes back to the need for policy and advocacy. We sort of have to accept and recognize that we don't have complete control over it. And even if you're doing something in your home, or really, carefully monitoring what your kid eats, unfortunately, it's not perfect.
Right. When you talked about DDT, I did a quick search about how long has DDT been around, and I saw that it was first invented in like 1895, but its insecticide properties were discovered in like 1930s, and it became really widely used in the 50s. And I was sitting there counting back generations and thinking what you'd said about the transgenerational effects. It's pretty scary.
Yeah, it is. But I hope I'm not meaning to induce panic or, and we can't, all of the things that I'm talking about, the studies that we have, are sort of on a population level, not an individual level. So again, we can't really predict even everyone who smokes does not go on to get lung cancer. So there are a lot of factors, and we just say, do the best that you can, reduce your exposure to the largest degree. And in the meantime, advocate, within your own community or, at a larger level.
Well, that was one of our questions. What can we do on a local and state level to regulate the use of pesticides? And given that you're in New York and Massachusetts, that's probably something that maybe we need to talk about and work on, work with the State House to get more regulation.
Yeah, and a lot is happening. Things move much faster at the state level than they do at the federal level. And even, at the level of the marketplace. So again, pressuring the market. We've seen this with an example that I give a lot is BPA, bisphenol A in baby bottles. BPA is an endocrine disrupting chemical, probably most of you are familiar with it. It's also like estrogenic, so concerns about links with breast cancer as well. And so the BPA is banned in baby bottles now at the federal level, but first, mothers were educated about it and decided that they did not want to buy baby bottles that had BPA. And so the marketplace was pressured. It started to come out, and then individual states said, okay, we're not gonna sell baby bottles that have BPA in them. So a number of states started to regulate it. And then ultimately, industry said, okay, nobody wants these BPA baby bottles, so we're not going to make them anymore. A lot of times there'll be like a voluntary withdrawal. And then the federal government finally said, okay, BPA is not permitted in baby bottles anymore. But first we had to pressure the marketplace and do things on sort of like a state by state basis, which can be pretty effective. So that's what we see a lot of now with pesticides also. California, New York, and Connecticut to some degree have been kind of at the forefront of a lot of that legislation. But some of these individual states have a lot of power in the marketplace. So if we can get something done, in one state, then a lot of times it will benefit other states too. And then I say, just there, Beyond Pesticides is a great organization that's provided support to a lot of individual municipalities and does advocacy on the state level. So that's a good one. In New York, we have an organization called Clean and Healthy. I'm not sure what like the Massachusetts counterpart would be, but finding those health-based advocacy organizations who maybe are taking on this as a priority issue with legislators, and telling your legislator that, this is what, write to your legislator. And if enough people write, they have to start listening.
We're frozen for a minute, but I will.
I see that there's a BPS substitution question. I can continue to answer that. There's a lot of problems.
Sure.
I just saw that come up since I was talking about BPA.
Yeah.
Right. So this is regrettable substitution. And we see that with pesticides also. So with BPA, there's a couple of, other things to say about BPA. Somewhat of a success story on the BPA regulation, but the chemical industry was able to replace BPA with BPS or BPF, which have similar or potentially worse health impacts, almost the exact same molecule. So they substituted, one chemical with another chemical. They also, so that's one thing that happens a lot. The other thing that they did was only restrict BPA in certain products. So BPA is still in the lining of aluminum cans because industry says we can't possibly make an aluminum can that will hold tomatoes or acidic products without lining it with one of these products. So there's like that piecemeal, sometimes we say it's like whack-a-mole way of regulating chemicals in this country. And that's a problem and just something to be on the lookout. So when you advocate, kind of like, we don't want to substitute. We want you to ban this chemical as a class. But then we also need better like pre-market testing because so BPS and BPF should have been tested for the same outcomes. And then it sort of happens after the fact, after it gets into the market. And so just to say that regrettable substitution is similar to what we see with pesticide chemicals where DDT was terrible. We got rid of it. Then we had, chlorpyrifos, an organophosphate class of chemicals, also very bad and out there for decades. And now, we use more pyrethroids and neonicotinoids, but pyrethroids are also not without health concerns. So that was a long story, but just connecting.
Thank you. Heidi just gave us a link for Massachusetts. I will copy that and put that in the message that I will send out tomorrow. I also, on another line, got a comment from somebody wanting to make sure that people realize that showering is not enough to remove ticks. But it's good to do it, and it's good to get naked because then you can see.
That. Yes, that's a good catch. I didn't mean that you could shower them off. I meant, particularly like I do this with my kids, so that you can check.
Yes. And Alex, go ahead.
No, I was just saying I'll make that more clear in the future.
And Alice asks us, does your advice for non-chemical ways to reduce risks from ticks conflict with the advice many of our past speakers have given for enhancing biodiversity and supporting wildlife in our yards, such as no mow or replacing lawns with native plants and leaving these plants standing over the winter?
Oh, that's so hard. Yeah, no mow is a hard one. And there was that another comment about the taller grass too. No, I don't think that it conflicts with, putting native plantings. I don't suggest that you have, a totally like, I don't know, barren landscape so that there's no vegetation that ticks like. I think, I'm big on planting pollinator friendly native gardens also in my own yard. I think it's more about being careful, checking yourself, protecting yourself, but I don't want to get rid of all those things. But at the same time, I talk to a lot of people who are very panicked about tick-borne illness, and I understand that too, especially with small children. And so they want to spray the whole yard with pyrethroids, and I don't want them to spray their whole yard with pyrethroids. So it is a conflict, but that's the number one thing that I'm trying to avoid.
One more coming in. And do other places in the world prohibit the use of BPA? If one were to buy a can of tomatoes from Italy, would that be safe?
I'm not sure. I mean, I'm actually not totally sure about what they do about tomatoes in Italy. One recommendation that we make that's hard to do is some tomatoes are in glass. And so if you can find tomatoes that are packaged in glass, that's a better alternative. I sometimes also like roast my own tomatoes. So, and so cook it, get whole tomatoes and cook them down instead of using the canned tomatoes is another one that I do. It's very, very hard. But again, that just sort of gets at the question. I'm not totally sure about European practice, but it does get at the question of transparency. And so you will see cans that say BPA free, but they don't say what it is. And it could be BPS or BPF. Some of the Tetra Pak, you can also get tomatoes in like the cardboard Tetra Pak. And those are reportedly lined with like a wax that does not contain any of the bisphenols. So that's, I mean, it's a burden on the consumer to call the company. And sometimes they change practices. And so it's difficult to even know. It's very hard to know. So we need transparency as the long.
You said those calls, putting pressure on the companies is good. So those calls probably create extra pressure.
Definitely.
So, great. Well, again, thank you so much. Thank you. Thank you, everyone. Eileen just sent in a note saying what an excellent presentation you gave, and it was just amazing. Thank you for being here. Thank you to everyone who's here with us tonight. Thank you for joining us for the whole spring webinar season. Good night.
Thank you.